Assalamualaikum. My name is Dr. Abia Farooq. Today I have allotted the case number 2. On examination, there are 2 ulcerated plaque over the left lateral ankle joint. Larger one is over the left lateral malleoli, 4 into 3 centimeter in diameter, somewhat oval in shape, tender, not adherent to the underlying surface, having well defined hyperpigmented border with some scaling and some hemorrhagic crust. Plaque is in resolving phase. Some punched out ulceration is present with some reddish healthy granulation tissue at the floor. Some area of atrophy is also appreciated in the center of the plaque, and healed area is also present in the center of the plaque. Surrounding skin is hyperpigmented, and there are some atrophic porcelain white scarring is present in the surrounding skin. The other plaque which is present nearby on the dorsum of the ankle joint, having similar morphology. Then I will check the edema on both. Then I will check I will look for similar lesion on the other leg, and I will check the both the legs and both the feet, dorsum of the feet, and also from the and also the soles of the feet. I will check the web spaces and nails also. I will check the pedal edema bilaterally, and also I will palpate the dorsalis pedis and posterior tibial artery bilaterally, and also I will check the movement of the ankle joint in both the ankle joint, and then I will check the lymph nodes in the knee, in the popliteal fossa. And my diagnosis is Atrophie Blanche. I will also check the varicosities and signs of other chronic venous insufficiency.
Is cutaneous leishmaniasis, atypical mycobacterial infection, and sporotrichosis. So for investigations, I will first of all like to perform a slit skin smear to check for LT bodies, then skin biopsy for histology, which in the case of leishmaniasis will show oval to round organisms, that is amastigotes, in the reticuloendothelial cells. In the case of atypical mycobacterial infection, it will show granulomatous inflammation, and in the case of sporotrichosis, it will show cigar-shaped yeast cells. So after performing biopsy, then I would also like to perform deep fungal culture to rule out sporotrichosis, and atypical mycobacterial culture to rule out atypical mycobacterial infection. So these are the main tests for the diagnosis and the differential diagnosis. And also if it's leishmaniasis, then before administering the drugs, I would also like to perform ECG. I would like to perform serum amylase, ultrasound abdomen if there's any abnormality in the serum amylase, LFTs, and liver function tests, and renal function tests. And as for the treatment, if it's leishmaniasis, then since it's less than 3, I will give local therapies. In local therapies, I have the options of cryotherapy, of electrocautery, and also intralesional antimonial compounds, intralesional sodium stibogluconate or meglumine antimoniate, 1 to 2 ml. And in the case of sporotrichosis, I can give tablet itraconazole 200 mg once a day until clinical improvement, and can also give terbinafine 250 mg once a day until clinical improvement. Case of atypical mycobacterial infections, can give clarithromycin or ethambutol until clinical recovery, which is around 6 weeks. Thank you.